Let's talk a little bit about the cost. Cost is the disease in healthcare. Cost is the disease. Total spent 4.9 trillion in 2023. That's an average of $14,570 per person, which is 17.6% of American GDP. Let's break down who pays for it, right? Private healthcare, 1.5 trillion. Medicare, 1 trillion. Medicaid, 880 billion. Out of pocket, 490 billion, or 10% of the cost. Think about that. Only 10% of the cost that you're paying, those crazy prices you're paying, that crazy amount that you can barely afford, only 10% of it is what you pay out of pocket. That's wild. How does it cost so much money? Administration is a huge part of it. When you talk about hospitals, right? 33% of all spending. Same MRI, one state, $400, and another, it's $4,000. That's just crazy. But that's why I say healthcare needs to be done at a state level because of the different infrastructures and the setups of all the state governments. It doesn't make sense to do it on a national level when the structures change everywhere depending on the state, right? If there's a certain state that struggles to it, maybe there should be some sort to kind of help them get to a point where they can be self-sustaining, but that's where we need to be, to a degree like that. It needs to be done at the state level because state governments, even Republicans, they are far more willing to come to a compromise and things like that than we are in the national government or federal government. I'm sorry. And it doesn't make sense. It just doesn't make sense. And especially when you break down the cost, right? California versus like my home state, Michigan, very vastly different cost structures. So how can you really create a sustainable and a system that works for the average person at the federal level when you have such vast differences? Let's talk a little bit about waste, right? At least 30% of all health spending in the United States is waste. That's 1.4 trillion out of all that money per year that's considered wasteful. Yeah, I'm sure that you can get plus or minus depending, right? Let's even get down to another one. Administrative cost in the United States. 8% of US healthcare spending goes to administration compared to, let's say, Europe, 2 to 4%. I get that it's quote unquote nationalized systems in a lot of countries there, but the Norwegians don't have a nationalized system. It's very similar to ours, a little bit more different aspects of it, but they do it correct. I would say correctly, but they do it in a better way that works for the average person there. But we're drowning in paperwork and markups. Americans are paying luxury prices for a bureaucracy while outcomes lag behind our peers, right? And when you look at our system, the amount of hospitals, doctors, not doctors, but beds in hospital systems, cancer centers, all these are the amount of them are regulated by the government. So when you talk about, well, no, the government limits the players. So yeah, there is an oligarchy, especially when it comes to healthcare, right? There's no competitive, it's just not it's not competitive. Be competitive for the nurses and doctors looking for jobs, but it's definitely not competitive for the person who receiving the service. It's just not. Like the cost structure shows it. Why do we spend more on clerks and coding than Europe spends on doctors? If your mechanic charged you triple to fill out a form, would you keep going back? I wouldn't. When the bill is this big, do subsidies do anything except hide the bleeding? Like I said, all it does is shift it from what you see on what you're going, oh, I'm paying this much for healthcare to the government coming to you at some point, hey, we got to raise taxes, the deficit's going up, we got to increase usage taxes, or we got to cut back on this. It's going to happen. The money comes from somewhere. Every country set up like that, even a communist country, the money has to come from somewhere. Don't let either side fool you because they're both lying to you. Democrats and Republicans are lying to you. Subsidies are not a fix. Demand that they go after waste, markups, broken pricing, and administration. You tackle those four, you can control healthcare costs for employers and Americans, and you can even work on implementing a hybrid system or like some kind of concept, right? I'm going to talk about a concept that they've used in several nations. I'm not saying we have to do this. I'm just saying it's a starting point.